I just would like to thank the whole team at the NIHR, ARC in Kent Surrey in Sussex, and of course Professor Sally Kendall for this opportunity to present to a wonderful group. Can I have the next slide, please? So getting started with evidence synthesis, I really would like to touch on what evidence synthesis is, what types of synthesis, the kind of approaches and methods that could be involved. And the big question that all of us always ask, whether you're experienced or not, is where do I start? And what type of review is right for me? Next slide, please. The objectives are really to have an understanding of different types of evidence synthesis. And by the end of this session, I hope you will have an understanding of the key principles, particularly systematic reviewing, and the types of approaches that we might be able to use to answer different types of questions. Next slide, please. So why synthesize the evidence? And I think whether you're doing a systematic review or any type of review, this is a big question. So we want our practitioners to keep up to date, and we must always be mindful of evidence-based practice. Just touch on that in a bit. And we also want to avoid unnecessary primary research. When we are reviewing literature and we're looking at primary studies, we often highlight lots of inconsistencies and biases. Hence, we use the tools that helps us critically appraise the literature. Also, evidence synthesis is a great way of identifying where further research is needed, because funding bodies and guideline providers don't always prioritize research questions unless they have an evidence review or an evidence base. But really, very importantly, prevent the use of harmful or ineffective treatments and interventions. And this happens a lot when we are doing systematic reviews. And also, it's very resource intensive. If evidence synthesis is to inform evidence-based practice, we want to also prevent ineffective use of resources. Next slide, please. So the problem is we want to know what works. Our guideline as developers, everybody wants to know what works to prevent, what works to improve physical activity, what works to prevent obesity, all these things. But we need to reduce these large amounts of information. And what evidence synthesis does is enable us to put them into palatable chunks. And that is the reason why we think about evidence synthesis and hopefully do it according to our questions. Next slide, please. So what happens if we don't review the evidence systematically? I like to bring this up just to remind ourselves that we could waste time and money with unnecessary research. So much evidence is put together unsystematically. And also, I quote here from Douglas Altman, a great epidemiologist and a statistician, that if we had not used scientific methods, then even advice on life-saving therapies could have been delayed for more than a decade, while other treatments have been recommended long after controlled research has shown them to be harmful. Let me give you an example. Next slide, please. So this is an example. There was a meta-analysis, which is a pooling together of studies, which indicated that streptokinase for patients hospitalized with a heart attack could have been shown to be life-saving almost 20 years before it was generally adopted in practice. And the other reason what happens if we don't do things systematically is that by 1980s, as an example, there was overwhelming evidence that giving steroids to women who are at risk of giving birth prematurely reduced the frequency of respiratory distress and death in newborns. Despite that, researchers continued to do unnecessary randomized controlled trials. Next slide, please. So I like to touch on evidence-based practice, because on the left-hand side is our evidence from research or evidence synthesis. And, evidence synthesis informs evidence-based practice, which actually provides the evidence-based healthcare. So here you can see that evidence-based healthcare decision is an integration of our evidence that we produce, the patient's preferences and values, the clinical expertise, and the available resources. That's where evidence synthesis come into this whole process of evidence-based healthcare decision. Thank you. Next slide, please. So there are lots and lots of different types of evidence synthesis. So I've just done a very simple diagram here. We start with scoping review, and I'm not going to talk about that because Cynthia's going to talk about that a lot. But a scoping review gives an overview or a map of reviews. Systematic review or meta-analysis, they're the most commonly referred to type of evidence synthesis when we talk about evidence synthesis. And I will touch on systematic reviews a bit more. But we've got a literature review there, which is quite a broad term with a wide scope, and it's pretty non-standardized and not systemized overview or a narrative review. And then we've got a rapid review. Again, we've seen rapid reviews more recently with the COVID data and the COVID evidence. And really, rapid reviews are where we've got time constraints and we need to inform the policy and practice rather quickly. So there are different methodologies for a rapid review. And then we've got what we now call an umbrella review or review of reviews. And as it says on this slide, there could be multiple systematic reviews which look at different interventions in the same condition, or they're still looking at the same intervention in various different conditions. Either way, there are multiple systematic reviews, and making sense of where we want to go next is often doing a systematic review of systematic reviews, an umbrella review. And recently, there have been other developments. There's integrative reviews, where in one review, where you synthesize different types of studies like qualitative, quantitative, and so on. They do have a good quality methodological approach, a systematic approach. And in the more recent years, we have come across realist synthesis, which is really about understanding the context and mechanisms by which interventions work or they don't work in practice. It's what works for whom, in what circumstances, and in what conditions. So again, all these types of review have got their own tools and methods of conducting an evidence synthesis, but I'll go through some of the examples of some of them. And then the meta-analysis is often a component of a big systematic review, and I'm not going to go into that, but basically it's a statistical pooling of all the studies which are similar. They've got very minimal clinical heterogeneity, very minimal statistical heterogeneity, and you definitely need a statistician to do that. So next slide, please. So here is just a quick slide on, I mentioned systematic review and I mentioned traditional reviews. On the left-hand side, if you look at just a literature review, there's no inclusion, very little inclusion criteria, no systematic search methods, only looks at published research. And, narrative reviews or traditional overviews or literature reviews can be very subjective and uncritical, and more often than not, they are not replicable. And then our systematic review requires us to have a clearly defined inclusion criteria, a clearly defined research question, a very focused research question. It requires us to look at evidence more comprehensively, including unpublished research. And in the objective of doing a systematic review, it almost always includes an assessment of the study that you're including in your evidence synthesis in terms of quality assessment or critical appraisal. And then the synthesis is really taking that transparent approach, that high standard approach, with a gold standard methodology to look at what does all that collective data show. Next slide, please. So these are types of systematic reviews. And well, if you look at systematic, I've discussed the types of evidence synthesis. Now this is really types of systematic reviews. So traditionally, systematic reviews from Cochrane, for example, looked at which interventions are effective and which are not, so compared to the effectiveness. And most of the time we used quantitative studies, and we still do, such as randomized controlled trials or controlled comparisons where one intervention is compared with a control. But then over the years, we've got systematic review of qualitative studies where your question might be about the views and experiences of patients or participants in a study and how they inform the outcomes of your review. So that's called the systematic review of qualitative studies. And we need to ask those questions. And other systematic reviews also ask questions like, is a body mass index associated with cancer, for example? And these are observational studies. Now you've got systematic review of observational studies and factors that shape patient experience. So on the right-hand side, I've just given references of examples of different types of these reviews that we've conducted in our department. As an example of a quantitative study looking at effectiveness, there's qualitative studies, and also another approach is the types of systematic review could be mixed methods, where it could be a two-stage. The stage one could be a systematic mapping to get an overview of what the literature is, but done systematically so that it can inform an in-depth systematic review. It's called mixed methods, and I will touch on that later. Systematic review is a meta-analysis, which I've already mentioned. And then I also mentioned systematic review of reviews. And perhaps just to think about why we might want to do systematic review of reviews, because it can give an overview, and you might argue that a narrative literature review can give an overview, but this is a systematic review of reviews. It also prevents duplication where there are already systematic reviews. Certainly, with the examples I've given on the right, the behavioral and psychological symptoms of dementia, I located so many systematic reviews on that interventions. And then you also build on work that has already been done. So that's the advantage of systematic review of reviews. And also an umbrella review is often quicker than a systematic review. So this is just to give you a feel for, even within systematic reviews, there are different types. Next slide, please. However, the systematic review process applies to all those types of reviews. Yes, the tools you use are different. Data extraction tools, critical appraisal, ways of conducting it may be different using different parameters, but the overall process is the same. We define the question using a PCOS, which is participants, interventions, comparisons, what sort of outcomes, and the S is more like study types. I'm not going to go into this because we've got a breakout session more on how does your review question guide both the type of evidence synthesis and the process of conducting the systematic review. Then you search for and screen studies according to your search strategy. And then we assess study quality and risk of bias, called critical appraisal. And if it's a systematic review, we need to do that across all types of systematic review. Even realist reviews have a method of critical appraisal. And then, of course, we do a synthesis. So if it is interventions you're pulling together, the size of the effect of interventions, and if the studies are deemed to be similar in nature, in outcomes and interventions, we may consider a meta-analysis. If the systematic review is about shaping patient experiences and factors that might contribute to dementia or any condition, we would do a thematic analysis, like the example I gave in one of our own reviews about the views and experiences of behavioral symptoms in people with dementia. And you would then do a narrative analysis if that's what's required. Sometimes with complex interventions, which are not drug trials, so complex interventions means that interventions got lots of different components. So for example, physical activity interventions could be the delivery, could be the intensity, lots of components. So we may not be able to combine or pool the studies together. So we would need to do a narrative synthesis. And then final, what does the data show us? And so the dissemination, and at this stage, we work towards how does it inform evidence-based practice? Where does it go from here into evidence-based healthcare decision-making? That's for another day. But this is just to give you an overview of the systematic review process. Next slide, please. So this is an example of a mixed methods review. This is taken from studies done by the EPI Center, which is the Evidence for Policy and Practice, at the University of London. And the question they were asking is, what is known about the barriers and facilitators of healthy eating amongst children? Do interventions promote healthy eating amongst children? What are the children's perspectives on healthy eating? And how does this inform intervention development? I'll put this as an example because this is a typical mixed methods review. So again, this is something we've done in one of my citations I gave you, a stage 1 followed by a stage 2. So in this mixed methods review, you're actually combining and integrating different types of study design. So first thing you do is search for the relevant studies. And what this group did for the first stage, systematic mapping, they identified the high priority studies they wanted to conduct for an in-depth systematic review. So they identified some sound outcome evaluations. In this case, they were randomized controlled trials. And then they looked at all the qualitative studies, which were about views studies, so experiences, perspective, and views of people around healthy eating amongst children, families' views, participants' views. But for both those approaches, we had synthesis 1 and synthesis 2, and both used the systematic review process that I outlined in the previous slide. So quality assessment, extracting data, and for the quantitative studies, you could pool the studies in the meta-analysis, or you could just do a narrative. For the synthesis 2, which is qualitative studies, we can call that a thematic or a meta-synthesis as opposed to meta-analysis. And once they had that, they were able to find out, combine, look at the trials with interventions, look at the view studies, and find out what sort of views and qualitative data inform the intervention development. So they matched the two to see if there were any gaps in intervention development. This is an excellent method that's been developed more recently because it reaches not just interventions, but it reaches patients' views, patients' needs. If we are to target interventions, we really need to combine the data from the qualitative and the quantitative so that we can get some meaningful way forward, the types of interventions that you may want to develop and evaluate in time, ones that needs to incorporate the views of participants. And these are integrated in simple language. I tell people that the quantitative and the qualitative are talking to each other in one systematic review. Next slide, please. So one of the most important part is protocols and reporting. It is really important. Registering a protocol for a systematic review is become increasingly important now. The reviewers are asking for it. The value of it is that you're not then just dealing with some arbitrary process. You've got a guideline, you are adhering to that, and also more recent evidence shows that systematic reviews that are registered, for example, on Prospero, are deemed to be of a much higher quality than protocols that are not registered. And the PRISMA statement is really about reporting, but they are also used as a guideline. You can use them as a guideline to conduct your systematic review. There is a PRISMA extension for protocols, and there is the Cochrane Handbook for protocol registration and reporting. And again, even with scoping review, which is not a traditional systematic review, there is a PRISMA standard actually for a scoping review protocol. If you are reporting on a scoping review or you're conducting, use that as a guidance. And again, as the slide shows on the right, you don't want to reach your conclusions before you've even started the protocol. So I hope that we'll be able to touch on this later on. Next slide, please. So in summary, just a quick overview. Clinical decisions should be informed by evidence, and it's really about what type of evidence. And therefore, we want high quality evidence. We want evidence that's conducted systematically. We want evidence that the guidelines will use to put evidence into practice. And therefore, evidence synthesis is a very key part of evidence-based practice. There are, as you can see, different methods for evidence synthesis. In the breakout session 2, we'll be discussing more about, what review is right for me, what review is right for you. And just to bear in mind that the approach you decide to take will depend on the type of question, the strength of the evidence, the purpose of the review, and please don't forget the timeline. I've got a decision tree to share later on about how do you decide where you start with. And systematic reviews are resource intensive, time intensive. So there are questions you need to ask: what your time scale is, what is it, what sort of resources you've got. One person cannot do a systematic review, and then decide if there are lots of systematic reviews, would it be better to do a review of reviews, and so on. So I hope that this overview has been helpful. Next slide, please. So here is just a decision tree that I mentioned. I understand that this will be shared later on in the breakout rooms. So thank you very much. And here are some references to There are, by the way, I have to say that all the different types of systematic reviews. Qualitative, there is now a Cochrane qualitative and implementation group. And then there is the Cochrane diagnostic and screening group, because some systematic review would be about diagnosis and screening. There's a separate guidelines for that. There are tools for every type of different types of systematic review that you wish to do, including observational studies. The M-STAR, which is listed at the bottom, is for umbrella reviews. And again, much tried and tested and validated. So I hope some of these tools will be helpful in deciding which one to use for which review. Thank you.